Sharing the Care of Mechanical Circulatory Support by Megan Hooper. So the executive summary, our mission statement is to provide patient-centered healthcare with excellence in quality, service, and access. Our vision is to serve all people achieve their full potential for health and well-being. We work to be trusted by patients and be creators of positive change. Our values are innovative, passionate, accountable, and compassionate. Our approach to care is to care for a patient with a mechanical support system implant in different areas. We believe that developing a relationship with patients and their families so that they may always have a comfortable and trusting group of caregivers around them. Our team consists of highly trained and committed clinicians who are dedicated to providing patients with the best care available. There is a need for quality care to this group. The combination of improved survival and evolving implant strategies has led to an increasing number of mechanical circulatory support recipients being integrated into the community and the growth of an ambulatory mechanical circulatory support population with a unique set of clinical needs. Improving the quality to chronic care. We strive to improve patient access to quality care and quality of life with the overreaching goal of improving clinician outcomes. We remain intimately involved in the care of patients. We will work to become resident experts in the management of patients with mechanical circulatory support implants. We'll have increased referrals from regional cardiologists as a provider of advanced heart failure therapies. Maintaining revenues from an increased ambulatory visits and potential hospitalizations. Our strategic objectives are a commitment of designated MCS team that includes a supervising cardiologist and an advanced practice nurse coordinator. Purchase and maintenance of equipment, so system controllers, batteries, and power cables, and driveline management supplies to include dressings. We will have regular, easily accessible bidirectional communication between implanting centers and our shared care site. Continuing education, the initial training of mechanical circulatory support evaluation and patient management. We will complete preceptorships at the implanting centers, industry-sponsored in-servicing, and online mechanical circulatory support training modules. Our ongoing education will be periodic symposium where the shared care team observes care at the implanting center with didactic training sessions. The implant team travels to the shared care site for collaborative clinicals of shared patients and to provide updates about changes in best practices. Annual skills day at the implanting centers and regular participation in continuing medical education activities related to mechanical circulatory support with attendance at scientific meetings focused on the care of left ventricular assist device recipients. Establish protocols about routine management practices as well as emergency evaluation, written policies for common device related complications specific for the implanting site, such as driveline infection, gastrointestinal bleeding, and arrhythmias, and regular quality assessments of shared care patients. Our balanced scorecard, from our financial perspective, we will look at volume related to reimbursement rates and growth related to quarterly reports. Customer service will continue with turnover rates, satisfaction, and satisfaction scores. Our internal perspective, we will analyze clinical outcomes through clinical surveillance, adverse events related to mortality rates. Innovation and learning, we will look at readmission rate using the 30-day readmission rate report, staff efficiency, looking at productivity versus the input and output. Our key performance indicators to gauge, strategize, measure, innovate, and propagate, looking at the ratio of total revenues to total cost, bed occupancy and turnover, canceled appointments, staff satisfaction, turnover, and patient satisfaction rate. Our SWOT analysis, our strengths to remain intimately involved in the care of our patients, become resident experts in the management of patients with mechanical circulatory support systems, increased referral from regional cardiologists as a provider of advanced heart therapy technologies, maintaining revenue from increased ambulatory visits and potential hospitalizations. Our weaknesses include the cost of a nurse care coordinator, although likely a heart failure nurse with other patient responsibilities, the need for repeated in-service training, the cost of mechanical support supplies specific to the console and peripheral supplies, perceived liability about practicing outside the scope of expertise for inpatient personnel beyond the core mechanical support team. Opportunities include the ability to maintain continuity of patient care, increase in local referral volume given their identification as an advanced heart failure specialist, reimbursement for follow-up mechanical support system care, increased professional satisfaction, and threats include being able to deliver equitable care over a wide geographic area, and inferior quality care leading to potential worse outcomes. Our factors contributing to providing care. Patient-centered care programs are ones where individuals' values, preferences are elicited and guided all aspects of healthcare, supporting their realistic health and life goals. This type of care is achieved through a collaborative relationship and decision-making process among the person, their chosen support, and their medical and social service providers. Chronic complicated health conditions. Families often get care and services from multiple sources. Shared care planning can help the family and various professionals involved align their efforts. Better communication and coordination can save time and money for families and providers alike. The aims of care: to provide outpatient follow-up exam and surveillance testing at our center to monitor patients supported by any mechanical circulatory support system. We'll provide the protocol and algorithms we use for blood pressure, driveline exit site, alarm history, surveillance blood work, echocardiography monitoring in this patient population. Improve patient access to care and quality of life with the overreaching goal of improving clinical outcomes. And here are the references for the presentation, and I thank you for watching.